Hi, everybody. My name is Raj. My group members are Alexa, Bella, and Nicole. Our topic is: does social isolation affect physiological health for our group poster? Loneliness and social isolation are more than just emotional experiences, they're serious public health concerns. Social isolation means having few or no social connections, while loneliness is the feeling of being disconnected, even in a room full of people. In the US, 1 in 3 adults report feeling lonely, and 1 in 4 say they lack enough emotional support. These issues are especially common among young adults, immigrants, and people facing discrimination or poverty. Research links loneliness and isolation to a higher risk of heart disease, stroke, diabetes, depression, dementia, and even early death. The COVID 19 pandemic made things worse, especially for teens and kids, leading to long term mental health concerns. Digital tools can help, but they're not enough. Real in person connection is still vital to protect public health. Schools, workplaces, and communities must actively promote social engagement. Addressing loneliness isn't just emotional, it's life saving.
As human beings, we all need connection. Whether it's through friendships, family, or even casual conversations, feeling close to others plays a huge role in how we cope with life. When those connections are missing, people can experience social isolation, the lack of regular contact with others, and loneliness, the feeling of being emotionally alone even when surrounded by people. While these might seem like emotional issues, research has shown that they're much more than that. Loneliness and social isolation can take a real toll on our physical health. They are linked to serious problems such as heart disease, diabetes, depression, anxiety, dementia, and even an increased risk of early death. These effects are not just psychological. Chronic stress from feeling disconnected can increase cortisol levels, weaken the immune system, and create inflammation throughout the body. The COVID-19 pandemic made this issue even more visible. Social distancing was necessary to protect people from infection, but it also left many people feeling more alone than ever. This was especially true for older adults, teenagers, and marginalized groups. Mental health struggles rose sharply during this time, particularly among young people and LGBTQ plus youth who are already more vulnerable. It is not only personal relationships that matter. The places where people live and the resources available to them, such as parks, public transportation, and community programs, can make it easier or harder to stay socially connected. And while technology helped many stay in touch during the pandemic, it cannot fully replace face-to-face interaction. Too much screen time can even increase isolation and reduce physical activity. Understanding both the emotional and physical impacts of loneliness and social isolation is essential. By recognizing these issues early and creating more opportunities for a meaningful human connection, we can help protect people's mental and physical health and improve their quality of life.
Current literature strongly supports the connection between social isolation, loneliness, and negative health outcomes. According to Fontanilla, loneliness has been linked to a wide range of physical and mental health problems, including depression, poor sleep, impaired immune function, and increase of cardiovascular disease and dementia. Shankar highlights how these effects are not only present across adulthood but are especially concerning in children and adolescents, where isolation has been shown to contribute to anxiety, depression, and suicidal ideation. During the COVID-19 pandemic, the CDC reported that measures such as lockdowns and physical distancing significantly increased levels of isolation and loneliness across all age groups. Children and teens were particularly affected, with increases in emergency room visits related to mental health issues and a rise in reported cases of suicidal ideation. Parents also reported noticeable declines in their children's mental well-being during this time. Furthermore, the rise in reliance on digital technologies to stay connected, while helpful, also introduced complication. Shankar noted increased screen time, phone addiction, and reduced physical activity, especially among youth, as unintended consequences of efforts to stay socially connected online.
The research makes it clear social isolation doesn't just affect how we feel, it affects how our bodies function. When people are cut off from meaningful connection, it puts real stress on the body. Studies show that this kind of disconnection can lead to more inflammation, weaker immune responses, poor sleep, and even increase the risk of heart disease, dementia, and other serious health problems. What's especially concerning is that these effects aren't limited to older adults. As Shankar states, children and teens also suffer deeply from isolation, with rising rates of anxiety, depression, and even suicidal thoughts. During the COVID-19 pandemic, the CDC saw spikes in mental health-related ER visits and drops in overall well-being, all tied to the loss of everyday social interactions. While technology helps us stay connected from a distance, it's clear that video calls and social media aren't enough to protect our health. Human beings need real, in-person relationships to stay physically and mentally well. Moving forward, we need to create more opportunities for people to connect, especially in schools, community, and healthcare settings, because preventing loneliness is just as important as preventing disease.